Yes. It's starting. Ma'am?
Hello and welcome to the Power of Community, Alone Together. My name is Leona and I am a PNA member and I am here to welcome you. Welcome to our attendees. Welcome to our sponsors. Thank you to our sponsors. We just saw a slideshow that gave all of our sponsors acknowledgement. We're here together because we cannot meet in person. We're meeting online. Usually this event would be a big breakfast at the Greenwood Senior Center or the Finney Neighborhood Reserved Room. And we'd be eating breakfast together and hobnobbing and having coffee and chatting and having a wonderful presentation. So without the ability to meet in person, here we are on Zoom. I want to thank David Inman. He's our production manager helping us do this today over the internet. And I want to introduce myself. So my name is Leona Partridge. As I said, I've been a member of the PNA for a while with my husband, David Partridge. He's right next to me and he's helping. There he is, David, come in here. He's running a lot of the videos that you're going to see. He's quite technically skilled. And we got started with PNA when we got involved with Greenwood Senior Center's monthly bingo karaoke night. So I want to say a shout out to all of our bingo karaoke friends. Thanks for all the fun and we look forward to meeting with you. Thanks to Jean and Michael. Man, we miss you guys. So we got involved and we were so impressed with the amount of spirit and volunteerism that's part of the PNA. We are so impressed with the commitment there and we just wanted to do more. So here we are with you, celebrating the way we can still be together even though we may be alone. We have an exciting program. We have guest speakers, videos, and an opportunity for you to interact with us as well. So hopefully everybody's up and running, and if you need to grab a cup of coffee or a glass of water or a little snack during your lunch hour, please do that as well. Today's event will be recorded and we will be able to have it up on the internet so you can have access to that there anytime. So let's just talk about our sponsors and thank them once more. We're just going to take a minute here and show a quick video and thank you to all of our sponsors who made this possible.
Welcome to the 9th Annual Power of Community, Alone Together. We'd like to thank our sponsors. Our platinum sponsors are Piper Village, Era Living, premier residential retirement since 1987. Our gold sponsors are David Inman Productions and Home Street Bank. Our silver sponsors are Anchor Real Estate, Seattle, Washington, Swedish Health for Good, Diane and Jean-Luc Baer, Carrie Fowler and Jan Gray, Robin and Ron Lewis. Our bronze sponsors are Aging Wisdom, Crescent Builds, Home Care Assistance. Our village vendors are Family Resource Home Care, IRG Physical Therapy, Shelf Genie, and Shinewell Culinary Helpers. To view captions, click the up arrow to the right of CC at the bottom of the screen, then click Show Subtitle. Click Subtitle Settings to change caption size. Click View Full Transcript to review all captions. Welcome.
All right, thank you. And again, that was brought to us by David Inman Productions. So thank you for that, David. Thank you to all of our sponsors. As I said before, this would not be possible without you. And to all of our PNA members who have been supporting through the years, thank you for attending and supporting us again. This is a fundraiser, but it's supposed to be fun as well. So the reason we are meeting together is just to help infuse a little more energy and funds into the PNA. So the power of community, alone together. This is our theme. And we thought this was an important theme to bring up because as the COVID-19 virus has affected all of our lives, and since March, many of us have not gone anywhere unless it was necessary. it's affected everyone, including our seniors, to a great degree. A lot of the programs that they were used to participating in person have had to make quick changes, and we'll hear more about that later. But just consider for a moment, here we are mid-October, and now it's been, well, 7 months into our quarantine. And boy, there's been a lot of changes. I know for myself, I work as a nurse. I work at in a clinic. My work has gotten increased. I've had to work more. That's a big change. Some of us have not been able to work at all. That's a big change. And for those in our community who are seniors who have been depending on services or the ability to get out or have people come in, it's been a huge change. Social isolation it's an issue for seniors, but it's gotten much more intense during this time. And this is why we chose this theme today. What I want you to do is, as I was speaking about the impact that this has had on our lives, think about the emotions that it's brought up in you. I know for me, I got really tired of hearing the word canceled. Like every time I would open an email or a text message, it seemed like something else was getting canceled. And as grateful as I am for my health and my ability to go out into the community and work as a nurse, there's a lot of emotions that have been coming up. And so we want to hear from you. So this is your chance to interact with us. At the bottom of your Zoom box, you should see a little chat bubble. So I want you to go to that chat bubble, and we're going to invite all of you. I think we have, what is it, possibly 210 attendees right now. So I don't know how many of you are going to be able to do this, but I'm going to try to read all those emotions and get them back to you. One emotion, enter it in your chat bubble. Just the first word, the first emotion that comes to you. And we're going to hear from you now so I can share a little bit of what all of you are going through. I hear serenity, worried. Oh, wow, it's coming in. Discouragement, hopeful, anxious, tired, frustrated, grateful, sadness, powerlessness, worn out, bored, a little smiley face, anxious, frustrated, supported, worn down, frustrated and grateful, challenged, ugh, was that Charlie Brown? Grumpy, lonely, fed up, spicy, grateful, sleepy. I'm all over the map. I see gratitude. I'm occasionally drunk. Perseverance. I'm concerned. I'm overly concerned. I'm compassionate, and I see changes daily. That's right. We're always changing. I'm panicked, restless. Sometimes I feel aimless and energized at times. Living each day. Keep them coming. Wow, this is great. Uneasy. Grateful for the opportunity to change. That's good. Someone said our list sounds like the Seven Dwarfs. Grumpy, dopey. That's cute. Spaced out. I'm looking for silver linings. Grateful for my close friends. Uneasy, patient. So thank you. Your emotions are valid. They are, oh, here's some more. Stressed out, I'm trying to stay positive. Hopeful. So many emotions. I know sometimes you'll get together with a friend and say, man, I'm sorry, can I just tell you I've been feeling really anxious, or I've been feeling really down. And so many times you'll hear, that's exactly how I feel right now. I think we all have been learning that all of us are going through this on different levels, but we're all going through a huge change, and the impact is significant. So think of the way it's impacting you and myself, our families, our friends, and then think for a moment of the seniors in our community who have already been living alone and now are so isolated and so filled with change and adjusting everything that they've had to be doing from day to day. There are some positive emotions here, and I'm really glad to see those. I see hopeful and grateful, and that's how I'm feeling right now. I'm feeling really hopeful and grateful, and I think you will too, as you go on with this program and see all of the people in our own community who are providing support and contributing to the well-being of each other and especially our seniors. So now that we've talked a little bit about those emotions, I want to tell you about somebody very special to my heart. The reason that we got involved with the Greenwood Senior Center and their bingo karaoke was really because we saw the heart of the people and the volunteers who were working tirelessly to put it together, and we raised money for their services and the programs there. It's been a delight. And so the person that we first met that was part of the PNA is my next guest, Cecily Kaplan. She actually thought of the idea of putting the karaoke together with bingo, and it's been a successful fund driver. So Cecily is the Senior Programs Director of Finney Neighborhood Association. She's been at the PNA since 2006. Let's put our little Zoom fingers together and applause now for our special guest, Ms. Cecily Kaplan.
Thank you very much. I also want to take this opportunity to thank our sponsors. And I also want to thank our MCs, Leona and David Partridge and Josie Partridge, who really came through on some of the technology at the end. Thank you so much. And the team that worked on this event, Anna Maria King and Lee Harper, Karen Mack, Rihanna Nolette, and a special mention and shout out to David Inman and Mary Campbell. Thank you, thank you. So as you've heard, we may be experiencing the epidemic of COVID-19, but the epidemic of social isolation is serious for all, but most especially for seniors. And so we felt that this needed to be the focus of this year's Power of Community event. And we are so glad you could join us today to hear from Dr. Carla Perissinotto, hear about what we've been doing for our community, and to encourage and earn your financial support. This has been a challenging time for all. For those of us committed to the work of providing programs and social services for and being in relationship with senior adults in our community, the past 7 months have been an emotional roller coaster. This is just not what we do. We see people, we interact, we are there for our community. But what is there when we cannot be together in person? We had to figure that out right away, and we started with calls to our community to assess immediate needs like meals or doctor's appointments or pharmacy deliveries. Within a month, we had to make the hard decision that we were not reopening, and not anytime soon. With the knowledge that we knew that social isolation was already an epidemic and a serious health and mental health concern, we had to pivot. We are a program of the PNA, an organization that even during some very challenging and unprecedented crises supported this decision and provided the emotional scaffolding so we could ensure essential services would continue. And then there is the amazing and creative and stable staff at the GSC and the PNA Village, who have been working together for years and who were able to quickly move our support groups, counseling, and all of our programs fully online. We now have GSC Connects, a virtual senior center. We also have creative low-tech opportunities for those not online, including a paper newsletter with interactive ways of content, pen pal projects, telephone calling, socially distanced friendly visits, and front porch concerts. You will get to see a sampling of this throughout today's event. I can't end without thanking the City of Seattle and King County's Veterans, Seniors, and Human Services Hub funding, which has remained stable when all of our earned income had to come to a complete stop. I hope you will see that we have been helping seniors and that even though they might be alone, we are together with them, that we have been able to stay connected in unique and innovative ways, and that we are continuing to find creative opportunities and best practices to decrease social isolation in this COVID world. Thank you.
And thank you, Cecily. Thanks so many for all the ways that you've been contributing and giving to our community. And thank you for that update on how you've adjusted, and we will continue to adjust to support this community. I want to remind you, just mention before we see our next guest here, right behind me, a green screen created by my own 16-year-old daughter is a list of the ways that you can contribute today. So if you are the kind of person who writes a check, you can mail a check in. We have our address here. if you would like to use PayPal because that's convenient, go ahead and let's see if I can point backwards. Go ahead and use PayPal through PNA. And then this is so great. We have our QR code. You don't even need to have a QR code app on your phone. If you simply put your phone camera up there, it'll grab it. It'll direct you to our website and you can make a donation there. So we'll be reminding you of that later as well, but just wanted you to know that this screen is available for you to use as you need. So let me tell you about our next guest who's going to be coming on. By the way, we are up to 163 people together. So you may feel alone on your device, in your own home or in your car, wherever you are right now, but you are surrounded by 163 people who are joining you in this community today. So that's pretty special. Hello, everybody. I want to introduce our next special guest, and Amanda Froh has been a PNA board member since 2013. She has served as a board president for the last 2 years. And with all that's been happening in the last 2 years, I'm sure that serving in the PNA has felt like a full-time job, but it's been a volunteer job because she actually has another day job. And she is our Senior Deputy Prosecuting Attorney for the Criminal Division of the King County Prosecuting Attorney's Office right here. And since 2015, Amanda has specialized on prosecuting crimes of abuse, neglect, and financial exploitation that's perpetrated against the elderly and vulnerable adult victims throughout King County. Amanda lives right here in Phinney Ridge with her husband, Jeff, and her 10-year-old daughter, Eliza, both of whom are also longtime PNA volunteers. So Amanda, we thank you for your commitment and service to the PNA. Let's put our Zoom applausers together and welcome Amanda Froh.
Thank you, Leona, and hello, everybody. It's my very great honor to talk to you today and relay my personal thanks on behalf of the PNA Board of Directors for supporting the inspirational work of the GSC and the Village. As Leona told you, I'm not only the board president and a neighbor, but also an elder abuse prosecutor. We handle most of the felony criminal cases involving elderly and vulnerable adult victims throughout King County, including victims right here in Finneywood. Unfortunately, these cases happen everywhere. Elder abuse research shows us that there are 2 primary risk factors that make an older adult most susceptible to become a potential victim of elder abuse, especially financial exploitation. Those 2 factors are social isolation and cognitive impairment, such as Alzheimer's disease or dementia, even mild dementia. So hopefully you can see where I'm going with this. When I talked with Cecily earlier this week about this event, and even just when she addressed you, she used the phrase community scaffolding. And Cecily has a beautiful way with words. This phrase particularly struck me as a wonderful metaphor for the work being done here. The Village, as well as the day-to-day activities of the Senior Center that bring people together in direct and meaningful ways, are community scaffolding for our senior community. Scaffolding allows people to climb higher than they normally would be able to. Scaffolding allows people to be safe in uncertain circumstances. One can typically see through the bars of scaffolding, enabling supporters to watch the work and cheer the ascent upward. Multiple people can stand on scaffolding at once, supporting each other and sharing in an adventure. Scaffolding is a necessary component to building something amazing, and it's a safety net around a potentially dangerous situation. I would be thrilled to be out of a job because elder abuse no longer exists in our community. Unfortunately, that's not likely. Instead, we as a community must take action to prevent as many instances of future elder abuse as possible, and to mitigate those risk factors of social isolation and cognitive impairment. The community scaffolding built by the Greenwood Senior Center and the PNA Village get us at least partly there. But I'm certainly not the best person to tell you that. Instead, I invite you to watch this video of a Village member and a Village volunteer telling their own stories. And I hope you'll join me and the rest of the PNA board in financially supporting this important work today. Thank you.
I joined the Village program About 4 years ago, approximately, somebody suggested it to me that volunteered there in the soup kitchen at the time. His name was Eddie, and he suggested it, and I checked it out, and I was really glad that somebody had mentioned it to me.
For me, now that I'm semi-retired, working from home, more flexible schedule, I really wanted to give back, and I wanted to do things within the community where I live, you know? So it's really, I'm so happy. I'm still in my first year as a volunteer, but it's been everything I was hoping for.
Participation in PNA and my sense of community is almost overwhelming sometimes to think of what's gone on with people doing things for me. I've always been the type of person that did for others. I worked down in Greenwood. I belonged to the Senior Citizen Center as a youngster. I was younger than they were, at least. And I gave some lectures on things that I was interested in and other people were interested, which was antiques, actually. And now it's reversed, and I need some things to get me through the days and help me live here. And my husband passed several years ago, and he was always my go-to guy. And I looked for those things to be done. And I heard about PNA, and it was the best thing that's happened to me in years and years in being alone, which I get telephone calls from PNA members like Christina, and just to visit with me, like every other week. Once in a while, maybe it's every week, once a week. And we'll just chat about anything. And I really appreciate that so much.
You know, and none of this would happen if it weren't for them, you know, and that means that the village needs the funding.
That's right.
In order to be able to pay those, they're only part-time, most of them, but in order to be able to pay those staffers, they need the money. And the other thing is, it's my understanding a lot of the fundraising events, of course, have not been able to happen this year because of COVID. A lot of the fundraisers have been canceled. So, you know, the village and the larger PNA just really need financial support so that they can continue to serve our community and to help us in the ways that we've been talking about.
Right.
Hello, I'm Rihanna Nolet, Director of the Village Program here at the PNA. I want to first thank Kay Hurd and Helen Watley Ames for participating in our video. Helen has been gardening for Kay all summer, and it's wonderful to see how their friendship has developed and listen to them talk so passionately about the village. I also want to thank every volunteer and member of the PNA Village for really stepping up for each other and demonstrating the kindness and empathy that we really need to get through this. When COVID first emerged, we immediately heard from existing volunteers and others in the community saying, what can we do? So we got busy onboarding new volunteers, setting up phone trees, delivering groceries and supplies, walking dogs, pulling weeds, making and delivering masks, delivering lunches from the senior center and dinner from the fabulous pantry in Ballard. Really anything that we could think of that would provide some joy, connection, or nourishment while keeping everybody safe. The work continues, especially as some parts of our society begin to reopen, leaving our older neighbors still largely isolated and further intensifying that feeling of isolation. We were doing the work before COVID, and we're diving even deeper now and are well positioned to connect those that want to help with those who might need it. So I'll take this moment to say that if you or anyone you know could benefit from participating in the village, either as a member, a volunteer, or both, please reach out to us. We would love to hear from you. And of course, please consider making a gift today to support this important program. Thank you.
And thank you. Thank you, Cecily. Thank you, Rihanna. I also want to say thanks to Kate and Helen, who are especially a big role in those videos. Thank you so much. Thank you for the village. And we do want to see that continue. And we want to bolster you with more support, more scaffolding, as Amanda said. So again, here are the ways you can contribute. Be mindful of that and what would be an appropriate gift, whatever you're able to give today, and be hopeful and optimistic as well in your giving. So the topic of social isolation. Social isolation is a problem for all of us. And as we've heard, it's intensified for elders because of the nature of their own situation socially. So we have a specialist on this topic, and she is coming to us all the way from San Francisco today by the power of Zoom. I want to introduce her to you. Her name is Dr. Carla Perissinotto. She is the Associate Professor in the Division of Geriatrics in the Department of Medicine at the University of California in San Francisco. Dr. Perissinotto has gained national and international recognition for her research on the effects of loneliness on the health of older adults. In July this year, some members of our own PNA senior program staff had the opportunity to go here, or on Zoom, to hear Dr. Perissinotto speak at the Summit on Social Isolation, as well as read some of her material and the recent work she's done on COVID and its impact on social isolation. It's been a huge impact, and we are looking forward to hearing more from our expert on the topic. So please put your Zoom applause fingers together and let's welcome Dr. Carla Perissinotto.
Good morning. I think it's morning, afternoon. I'm not quite sure what time it is. Thank you so much for having me. It's really a pleasure to be a part of this, and you absolutely have the right topic to be discussing these days, given that it is so prevalent. I want to give a shout out to one of my colleagues and co-researchers, Ashman Kotwal, as a lot of the work that I'm going to be presenting is work that we are both doing. So what we're going to do in the brief 20 minutes that we have, I'm actually going to start by talking about the definitions to make sure we have our terms right. And then I'll specifically talk about what Leona mentioned is the study that I've been conducting during the pandemic. And then lastly, we'll talk a little bit about some practical things. What can we actually do clinically and community-wise for people around us who may be experiencing loneliness and isolation? So let's start with terminology. So as you've heard, the term social isolation is used quite a bit, as is loneliness. Often these terms are used interchangeably, but it's actually really important to know that they mean very different things. So when we talk about loneliness, this is actually the subjective feeling of being alone. So it's subjective, meaning that someone personally feels that there is a difference in the relationships that they want and those that they actually have in their life. And this is in comparison to social isolation, which is an objective measure, meaning it is quantifiable in terms of the number of connections that someone may have to family, friends, or their community. Now, as you can see by these circles, there is overlap between the two. So you can be both, or you can be one and not the other. And altogether, we can think of all of this being called social disconnection and the opposite of being socially connected. Now, all of these terms actually have emotional aspects, functional aspects, and structural. So the reason why this is important is that when you think about programs that PNA is providing, they may be targeting different parts of this. So some of things like meal delivery may actually be targeting social isolation versus the friendly visitor, as we saw, or the friendly connection, as we saw in the video right before this, may be targeting loneliness, or both. So now let's move on to what is actually happening during the pandemic, as evidenced by a study I've been conducting here in San Francisco in the Bay Area. So together with my colleagues, we actually conducted are in the process of conducting a study in the San Francisco Bay Area, and we recruited patients or participants from different sites to get a diverse sample. So we recruited from a geriatrics clinic from UCSF where I work. We recruited from Covia and Curry Senior Center. Covia and Curry Senior Center have both in-person and phone-based support programs for adults living in San Francisco. What we did is that we used phone surveys to assess people during the pandemic when shelter in place started in San Francisco, and asked people questions about how they were doing at 2 to 4 week follow-ups. We were very interested in knowing about people's psychological well-being, social connections, and medical needs. As we had a hypothesis that social isolation would be increasing because of the physical distancing and shelter-in-place orders in the area, and postulated that there would also be significant loneliness. And we worried about whether there would be unmet needs that we would be uncovering. So we have about 151 respondents. Given the frequency of our interviews, we have a total of 460 interviews. As you can see, the characteristics of our sample, the majority are women. We have a pretty diverse sample in terms of 70% being white, but actually 9% Black or African American identified, 5% Hispanic identified, 8% Asian, and 9% multi-ethnic. The other thing that's notable about the people we recruited for the study is that a large proportion lived alone. A smaller proportion were actually married. Almost half of the participants reported low finances, which can be a risk factor for isolation. And there was quite a bit of depression and anxiety, as well as other functional impairments, even at the start of the study, such as hearing impairment, vision impairment, all things that which can impact loneliness and isolation. I should mention that the other reason we've been interested in this in my area of research is that we know that both loneliness and isolation, as measured differently or together, have significant effects on health, including premature mortality, increasing rates of cognitive impairment, worsened diabetes, cardiovascular risk factors, and ultimately increased healthcare costs. So this is not insignificant, which is why we've been very concerned about what's happening during COVID. So what have we found? So at the start of the pandemic, our sample, about 30% had frequent feelings of loneliness. And what we've seen is that on average, 51% of our sample felt that their feelings of loneliness is actually worse. But important to know that this feeling was not universal. And I'll talk a little bit more about this. But what we see on this slide, what we see is going out weeks from when we started shelter in place in San Francisco, which was or shortly after shelter in place, so March, April timeline. And as the weeks went on, for some people, there was kind of a decreasing and then a plateau of what was going on. And so some of the theories is that perhaps unfortunately or fortunately, depending on how you look at it, people are getting used to this new normal or finding ways to adapt. However, what we do know is that there's a subset of people where there is actually significantly worse loneliness, and we'll talk about that a little bit. So for the group so there's 3 general patterns, and so one group actually had worsened and increasing loneliness during this pandemic. And as you can see, this is from a quote of a 64-year-old woman who says, "Before the virus, I was socializing and seeing people a lot, but now I feel a lot more lonely and isolated." And then on follow-up interviews, what she said is that she loves technology, but she has trouble keeping up. And she feels comfortable with it, but feels out of date. And this is probably something that's very common for many, that how do we continue to connect given that so much is moving digitally and online? Now, another pattern that we saw in our study is people who were lonely to start with, and they didn't see any change, but their loneliness just remained high. And what the quote here from a 66-year-old woman says, "I'm used to not doing anything, and it's been terrible." And then on 2 follow-ups, she says, "This has been the hardest thing I've had to do in my entire life." And she notes that the isolation has made my mental and physical health worse. And this is something that probably is consistently found in the research. And what we're concerned about is what this means long term. And then on the second follow-up, she notes that the longer the COVID is around, the more on edge people see. And what we also found in our studies that we're seeing increasing levels of anxiety and depression alongside these feelings of loneliness. Now, in the third pattern, we've seen some people whose loneliness was actually pretty mild and stayed mild and really no effect. And the quote here is from an 81-year-old man who said, he's in an assisted living facility. He's been a little isolated and they're confined. So we're safe, so things are pretty dull. So not a huge change, but again, there's different patterns here. And the point of all this, which I think is really important for us to think about, is that we cannot assume who is going to be lonely or not. And we can't assume everyone's going to be terrible or everyone's going to do really well, but recognize that different people are going to have different risk factors for how they're going to respond or adapt during the pandemic or even without the pandemic. So the other thing that's notable from our study, and as much like PNA has done, so much of the programs have been having to move either to digital or telephone, and that may be challenging for some of our older adults or even some of our low-income folks who don't have access to broadband or internet and can't afford some of these things. What we found in our study is for people who actually were connecting, telephone was the most common, so applaud you if this is a main part of your intervention, or of your programming. But another part here in our sample is that 79% had minimal to no video interactions. So that to me is a really important thing as we think about, as a senior center, as a community, who are we reaching and who are we missing out? 43% had minimal internet use. So again, important thing as we think about how we're reaching out in our community, how do we define community and how do we maintain that community? And as was said, how do we maintain the scaffolding for our community? The last thing that I will also point out as one of the results, and this paper has just been published in the last few weeks, is that many of our adults did have some increased isolation and had substantial unmet needs. Which included difficulty accessing medications, about 30% having food insecurity, which again highlights the importance of programs like the Village and other programs that PNA serves, because without these, many of our community members would be going without critical needs that are considered a basic and fundamental right to life and to well-being. So in summary, surprising that there are some people that have adapted quite well to the pandemic, thankfully, but there's still quite a few of adults who are not, who are feeling increased and worsened loneliness and who are at risk for worse health outcomes the longer this goes on. We do not know in our current research how long you must be lonely or isolated in order to see these negative health effects, but it is concerning. When we started this study, we thought, shelter in place and some of this would be a few weeks, maybe months, and now it seems to be dragging out, which actually is causing some trouble in our study because our participants are saying, how long are you going to keep asking me questions? And of course, that's the question of the hour, is that we do not know, the end in sight for this pandemic and when we will see normal or what will be the new normal. So pivoting from here, I want to talk about how do we then, given what we know about research, the health effects, what is happening during the pandemic, how do we meet the clinical needs or just general needs of our community dwelling adults? I want to point all of us to a report that was released in February, in which I had the pleasure of participating as a committee member at the National Academy of Sciences, Engineering, and Medicine. So we published a report on social isolation and loneliness and what the role of the healthcare system is. It is a very long report, but I wanted to give you just the brief highlights from the report. The first one that the report said is that we need a more robust evidence base. And what this means is that we actually have significant evidence on the health effects of loneliness and isolation, both, but we do not know, for example, as I said, how long you must be lonely and isolated to have negative health effects. And we also don't know exactly what to do once we identify people who are lonely or isolated. The second take home is that we must translate this research into healthcare practices. So how do we know, how do we then take the health implications and tell our healthcare systems what to do? The third step is improving awareness, and that's why I applaud PNA for holding this seminar for you all today so that we can continue to spread the word on the importance of social connection as something that is protective to our health in the same way that loneliness and isolation are detrimental to our health. The last one is strengthening ongoing education and training. That is part of what we're doing here. And part of my role as a physician and geriatrician and palliative medicine physician is to educate people in my community and people at my own institution and the future providers that are coming after me. And then the last part is strengthening ties between healthcare system and community-based networks. So that means, the task for you all as members of PNA and as supporters of PNA is how do you tell your healthcare systems around you about the phenomenal programs that you have so that you have a greater reach. So when I think a little bit more about what can we do as a community or what do we do as a healthcare system, I'm looking at it as a healthcare system because I primarily work in healthcare. I think about it from a population level framework. And what I mean by this is that when you think about loneliness and isolation, you can first think about primary prevention is how do we prevent the loneliness and isolation from setting in to start with? And that's primary prevention. What we know about that is that women, people of lower socioeconomic status, older adults, and actually recent evidence suggests that young adults are actually experiencing higher loneliness, and LGBTQ adults are at higher risk. Once someone has loneliness and isolation, and we've identified that, then it's the secondary prevention. So how do we decrease the consequences of that? Or how do we prevent that loneliness that may be mild from becoming severe? So much like in a pandemic, if we identify people early, can we do enough to identify, have that friendly visitor, have that connection so that person doesn't become chronically lonely? Another way to look at it is a pyramid of risk, is seeing who's at risk, who is starting to disconnect, and who is already remarkably isolated and lonely, because that's where we're going to have different effects on what we can do. Another way to frame this is, again, it's going back to what are our definitions? Are we looking at isolation, loneliness, or both? What is the population that we're interested in? So for you at PNA, who is the community that you're serving? I presume, and what I understand is a pretty diverse population, which means that the services you provide must meet the needs of a wide range of people. Some of low income, some of high income, potentially different linguistic and cultural needs, and are you meeting those needs? The reason that is important is that ultimately the programs that you are providing, so the intervention, really needs to match the mechanism by which someone is becoming lonely or isolated. So for example, if Mrs. Smith is lonely because she has hearing impairment, in some ways you have to figure out, how do I improve my communication with this person? Or how does we help her with her hearing impairment to mitigate the effects of her loneliness? Or is someone lonely because they literally are sheltering in place? So how do I increase ways of connecting with this person? And so once we figure out the mechanism, what the theory is for our program, our next steps is really trying to figure out, is our program working, and how do we implement some of these programs in a way that's going to affect the most people? So some of the take home from today's talk and some of my work is, and specifically around COVID, as I mentioned, is that many adults are experiencing worsening loneliness, but as I mentioned, it is not universal. It is therefore important to think about periodic assessments. And this may be something that's done, or what the National Academy of Sciences recommends is doing this in clinical settings. But one may argue that in some of the programs at PNA, it may be worthwhile to figure out, how is someone's loneliness at baseline? Are our programs having an effect on their loneliness scores. There are validated tools to do this. And so this is another way to actually help programs like PNAs figure out if they're working and how well they're working or how they can be improved. The second take home, as I mentioned, is that there's actually a marked digital divide. And what this means is that we have to be careful not to over-rely on technology-based solutions to address loneliness and isolation. Now, this is really challenging because this, in many ways, this has been the only way, or some of the only ways we connect with people. So the challenge here is thinking, who is the population that is already very well suited to receive technology-based interventions or programming? Who is left out? And if there's a gap, how can we make sure that one group of people who wants to connect but can't, how can we improve their access to technology so that they can join and continue to be a part of the community that you're building? The other thing is to think about, there actually are exceptions to allow safe in-person interactions. So this may mean, as we're learning, continued mask use and distancing. So we've gone from a period earlier in the pandemic where it was, advocated to have zero interactions, but now it's really thinking about, can we have interactions in person and can we do it safely? And I would encourage all of us in our communities and our families to think about the best way to do that without lowering our guard too much. That also means identifying who's at highest risk in a couple ways. One in terms of who has several medical factors that are going to make them more predisposed to getting sick if they do get sick or doing worse off. But also who's at highest risk for loneliness and isolation and its consequences. And those may be people where we have to do a little bit more work and actually think about the exceptions to do in-person interactions. The third part is thinking about, for people who we know are lonely, we have to think about, as I mentioned, why is that person lonely, and offer advice based on the mechanism. So direct reasons for loneliness may mean that they need more social support, more opportunities for interaction, and maladaptive cognition is really something that's more in the psychology realm, that is cognitive behavioral therapy for someone who may constantly think something like, I'm not liked, no one wants to talk to me, and how do we get someone out of this loop? There's indirect measures, which are one of the things I mentioned, such as vision and hearing impairments. In San Francisco, where I live, because of many homes having stairs, that actually ends up being a very tangible structural barrier for people connecting. And then there are other things like urinary incontinence I've seen in some of the research that I've done that actually keeps many people from connecting with others because they're embarrassed. And then lastly, establishing partners, as we know. So this is what we're doing here. Think about the community that you've built and that you're building and how to continue to build across your community. And then fourth, the unmet needs. As I'm sure many of you have realized in your community and in your program, sometimes when you connect with someone as a friend, as a support person, you may suddenly realize there are unmet needs. Technology is one, food resources, getting medications, and help with daily activity. So there's consequences to all of this in terms of other ways we can help adults. So lastly, in thinking about this partnership, one of the things that's critically needed, and I'm putting my research hat on here, is, sorry, that was my alarm, is how do we know that the programs that we are participating in and that we're advocating for work? Are we meeting the needs of the people we serve, and who could you be missing? How can you think about partnering with other researchers or academic institutions to really show the value of what you're doing? There is no doubt that the work you're doing is fantastic, but now our task is to show really a way that it works to get healthcare plans to pay for this, which is my ultimate goal. So in summary, I hope I've unfortunately demonstrated that loneliness and isolation are common, and COVID is definitely making it worse for some. We absolutely have opportunities to reach many, but we need to make sure our programs work, and we need to think about those adults that we are not reaching. Awareness and advocacy are critically important here. Speak up for those who can't. Absolutely, please make your voices heard, and know that connection is such a powerful way to protect our lives and our health. Thank you so much.
Oh, and thank you, Dr. Perissinotto. You done an invaluable work on this project, you and your partner, and all the things that you presented, I know affected me as a nurse working in the public, but also just being part of this event, the PNA, and how we are trying to meet those unmet needs that you spoke of. I think that's a vital part of what you presented for us today. So thank you. And I did just want to give a little shout out in case you didn't realize, everyone out there, Dr. Perissinotto also is the mother of a new, I think, 4-month-old baby. So again, congratulations to you. And thank you for all your contributions to this dire need, this program for eliminating social isolation. So we have more videos and more ways that we can encourage you to be part of what we're doing here in our own community to help decrease social isolation. Again, give. It's a good time to give, and you can just make it so easy. Put your phone up there on the screen to the QR code with your camera, take a photo of that, and it'll direct you right to our website at the Finney Center, finneycenter.org/give. So we have more to share with you now, and just ways that you can see how the Greenwood Senior Center is doing the work that Dr. Perissinotto spoke of, meeting with the community, finding their needs, and bringing the community together. So what we're going to see next is a further example of the village and about living alone. So you're going to see the Living Alone video, and that's a group that has actually been meeting monthly in person for quite a while. They were meeting for the last 15 years, twice a month. And that was the pattern for this group, to meet in person. But because of COVID, all of the meetings are now on Zoom, online, weekly. So this group is a virtual community, and sessions are enabling the individuals to share their experiences, their feelings, their concerns, and the resources they have or they don't have with one another. So we're going to see a short video about the village. Connected in that video, you'll see some information from our social worker, Karen Mack, and she's also the director of memory loss programs here at the PNA. You'll see a brief message from her, and then a second video presentation. So we're going to cut over to that video, and I hope that you'll enjoy this presentation. Thank you.
This has just been a godsend for me, and I would probably be just despondent if I hadn't had the living alone. I mean, it's really been a very tough. It's tougher now that we can't go outside, because that's where I used to talk to everyone.
Well, I think it's given me a sense of continuity between before the pandemic and after. Although it took me a while to figure out how to get on Zoom, but I finally did. So I'm really grateful to have it. This is the only Zoom call I've been on, but I think I can get it on others now too.
I appreciate this a lot. I've done the Living Alone with you for a long time, and always liked it for years. But now that I don't drive anymore, and so I'm just in my home. Fortunately, I have an outdoors when it's not smoky like this. But Zoom meetings and the connection that I have is really important. My daughter, I can't get together. My daughter can't come across the border and get down here, and so it's really important to me.
I'm doing this twice a month. Basically, every week I'm doing regularly, on average, 4 regular Zoom group things from the center, and occasionally some other things that are one-time events. And I just in recent couple of weeks or so, just feel more okay with the current situation. I think it's up till now, it's just been like, I kind of don't like this. But this is part of what helps me feel more sane and more okay. It's really great.
Well, since I've been coming to the Greenwood Senior Center for the Living Alone group for a long time, I really appreciate this programming, because it's our age group, and we can identify with each other. And it is hard having to stay home and stay in with this smoky bad air and the COVID and everything. It's just been really tough. And so I think it's been really valuable to have this meeting every other week. And I wouldn't mind having it every week too.
I really enjoy it. I look forward to it every week. It's kind of a break from my isolation. I wish it was you'd have it more often, maybe once a week.
The pandemic has taken a devastating toll on those with dementia and their spouses. The advanced stage group is composed of spouses who have placed their loved ones in adult family homes and memory loss facilities. They have had to adapt to severe restrictions regarding visitation, and this has been traumatic for them and their loved ones. Several of our members share their thoughts on what the group has meant to them. You will hear from Paul Hill, Denise Lentini, and Paula Schwimmer.
So as I said, being new to the area, I had no, other than my children, I had no support system.
Right.
And so the memory care group has been incredible. I think what probably is most important is how we're kind of all walking the same path in varying degrees, but it's the same route, and everybody is so willing to share their travel plans. And that's reassuring because you really feel like you're the only one out there. You know you're not, but you're not. And having people to share their ideas, their thoughts, but what's worked for them, what hasn't worked for them, has been really, really very helpful. I don't know how I would have survived if I didn't have this group. Let's put it that way.
In the group, of course, as Denise said, it's great to be with people in the same boat. You don't think you're crazy. You hear how other people are under the same kind of stresses and what they do, and that is a great experience. For me too, when I first joined the early stage group, I think Alice was much less advanced than a lot of people whose spouses were in the same group. And I learned so much about what was going to come and get me and how people prepared for it. And I said, oh, here it is. It really let me label things when they happened. And it helped a lot. I've also done a fair amount of one-on-ones with the people in the groups. And that's been a tremendous benefit, both in terms of ideas and just friendship.
I've been, I think, in your support groups also beginning at early stage. And I think many of the people, we've sort of grown up together. We've kind of moved to the mid stage and then now to the advanced stage. And I think I've developed a lot of close relationships with many of the people in those groups. And I think that's very important to me, because so many of my other friendship groups that, I've had prior have sort of fallen by the wayside a bit, because people really weren't sure how to cope and deal with Rafe, or my ability to not be able to go somewhere because I didn't have someone to stay with him. So I think, having those people as, a constant support. I think the other thing was validating my feelings. I think feelings that I might not be able to express to other people who might not understand, the people in the support group were able to, and they totally validated how I was feeling. And that was really important to me, that I wasn't alone in that.
Many thanks to everyone who put together those two videos from the Advanced Stage Memory Loss Spouse Support Group and the Living Alone video. Now, after watching those, I have a much better understanding of how they keep us all connected and healthy. My name is Maggie Knowles. I'm a daily money manager, which means that I help seniors and busy professionals stay on top of paying their bills. And I'm also a senior myself. So today I am proud and happy to speak on behalf of the PNA, Finney Neighborhood Association, the PNA Village, the Greenwood Senior Center, and the memory loss programs. One day, when I met some of the staff, it popped out of my mouth that in my view, they were essential workers. Well, it turns out the state of Washington agrees with me because on their list of essential workers, they include the following, and I quote, workers who provide support to vulnerable populations to ensure their health and well-being. We just heard Dr. Perissinotto talk about the vital importance of social connection, and my experience dovetails with her points. First, I have developed a group of friends, and we meet regularly online to share our concerns and our joys. It's for fun, but it also increases my mental health during this pandemic. I've also consulted with our gifted social worker, Karen Mack, and referred to her some of my senior clients who are really grateful for the memory loss programs that she leads. Throughout my years at the Senior Center, I've attended a variety of events. One of my favorites, which I hope we can go back to someday, is the Sprouts and Seniors program, where you get to interact with toddlers. But I've been to a number of great potlucks, pod events, classes, lectures, movies, all kinds of things. Since the pandemic, I've been an enthusiastic participant at the online coffee hour, which you are invited to join. So the programs for seniors have enriched my health and well-being in a big way. And now, with changing times, I'm excited to see how the staff will update and continue the GSC Connects and adapt other programs to our changing experience. For example, I'm excited to hear about the teleconference gardening group. What a cool idea. And I know I'm not alone. On Tuesday, I learned that a generous anonymous donor has contributed $5,000 specifically to help the Gathering Place and to offer scholarships to those in need of the memory loss programs. This donor is a community member who feels strongly about the needs for these services. Will you join him and me, if possible, right now, to give as much as you possibly can to these wonderful programs? Let's keep these essential workers in their jobs to support our health and well-being and keep us out of isolation. Again, you can find ways to contribute in the chat. So let's give big. Thank you.
Thank you, Maggie. Thank you for your heartfelt message and your own experiences here at the PNA. There are so many ways to get involved, to give, and to volunteer. And I just invite you, please take a moment, think, what can I give today? I know personally, there's money that I probably would have spent taking friends or family members out for a birthday dinner, or getting together while going to the bingo karaoke and spending money there. I can think of at least $100 to $200 I would have spent on these social engagements that are not happening. And I'm personally going to donate that, start there, to donate to the PNA. So if you're not a member, join. Please find ways you can give. Again, we have our green screen. This whole entire presentation is recorded, and it will be on the Finney neighborhood website. So again, that website is Finney, it's on your screen, finneycenter.org. Grab your camera, take a picture of that QR code so that you can give easily, and please be generous. We need these essential workers to be supported and continue this great program. We are just running a tad over time, but I invite you, please stay just a few more minutes because you're going to enjoy some great music. I want to give some thank yous, and then we're going to see a delightful little video. So this summer, there was a program started, the Front Porch program, connecting artists and musicians with seniors or those who are not able to leave their home. And so the program actually brought musicians out into the neighborhood. They would set up and perform on someone's front porch, of course, safely, socially distanced, but getting to all the performers getting to perform and share their gifts that have been also not been able to be shared, along with the people who haven't been able to go out and enjoy. So we're going to see a performance at the end here by the Denise Glover Trio, and they were one such group. The members of that trio are Denise Glover, Julian Smedley, and Greg Glassman. So Denise Glover Trio, we thank you for your time and commitment and what you've done in your performance sharing. I want to thank each and every attendee. Thank you. You are so needed, and we appreciate you for being here with us. And then a quick shout out again to David Inman, Cecily Kaplan, Anna Marie King, Mary Campbell, Lee Harper, Amanda Froh, Maggie Knowles, and Rihanna Nolette, Karen Mack, of course, Dr. Perissinotto for her expertise, members of the Living Alone Support Group, members of the Late Stage Memory Loss Support Group, all of the village participants, my family, David Partridge, are you still here, David? David's still here, and our daughter, Josephine, thank you. We appreciate each and every one of you. Again, be bold, give generously, and thank you. We're going to break now for our final goodbye and thank you, and you're going to enjoy this wonderful video of the Denise Glover Trio. Again, check us out at the pnafinny.org website and give big. Thank you.
Oh, it's called Mary the Forgotten One. I was traveling in the Badlands, got the power of life in my hands. I've come far to see him again, withstood tidal waves and violence of men. I am Mary, the forgotten one. History has done me wrong. I was a hero to him, but they said my love was only sin. As we stood under the burning tree, I blamed him and he blamed me. The flames grew high, I flew away, but now I know I should have stayed. I am Mary, the forgotten one. History has done me wrong. I was a hero to him, but they said my love was only sin. When you feel the power of stars in your hands, then you can heal the broken hearts and bodies of men. When they dragged him through the streets, I yelled out, "No, please take me." They would not hear, they were sure he was the one. They said God had no daughters, only a son.